Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Today presentation will continue history taking presentations. We'll speak today about diarrhea. History taking for diarrhea. As a definitions, diarrhea is increased the frequency of stools more than 3 days with increased stool weight more than 200 grams per day. Acute diarrhea is diarrhea lasting less than 2 weeks. Chronic diarrhea is diarrhea lasting more than 4 weeks. Tenesmus is a spasm of the anal sphincter associated with cramping and ineffective straining of stool. Steatorrhea is presence of excess fat in the stool. Stool will be bulky, difficult to flush, and color pale and oily appearance, and specifically foul smelling. There is 4 categories of diarrhea. It's either osmotic diarrhea, when the ingested solute is not absorbed, so the higher concentrate gradient within the gut will draw water into the intestinal lumen and increase the water content of the stool, like lactose intolerance. Secretory diarrhea, like infections, the intestine actively secrete water into the gut, like cholera, Clostridium, and E. coli or Staph aureus. Inflammatory diarrhea, intestinal inflammation itself lead to blood mucus protein oxidate, and this will accompanied by fluid and electrolyte secretion or increased fluid and electrolyte inside the gut itself, like an infection or inflammatory bowel disease or celiac disease. Motility disorder, either increase or decrease gut motility, will cause diarrhea. There is many causes for diarrhea. If we start with the infectious diarrhea or gastroenteritis, could be viral diarrhea like rotavirus or norovirus, bacterial like E. coli, Campylobacter, Vibrio cholera, Shigella, Salmonella or Yersinia, protozoal like amoeba or Giardia or Cryptosporidia, and pseudomembranous colitis like C. difficile, Clostridium difficile. Other infections like HIV and hepatitis A could cause diarrhea. Other GIT disease like inflammatory bowel disease, irritable bowel syndrome, celiac disease, tropical sprue, bacterial overgrowth, chronic pancreatitis, short bowel syndrome, bowel obstruction, and bowel cancer, collagenous or ischemic colitis, appendicitis or diverticulitis or RGIT disease can cause diarrhea. Very important to know endocrine disease that can cause diarrhea. It's very common to come in or present in PACES exam, like diabetes mellitus, hyperthyroidism, hypoparathyroidism, Addison disease, carcinoid syndrome, and viboma. And of course, this disease will be multiple complaints like diarrhea and weight loss, diarrhea and increased appetite, something like this. Other causes of diarrhea like too much alcohol can cause diarrhea, amyloidosis, lactulose intolerance, post-operative diarrhea, functional diarrhea, radiation therapy, spicy food and artificial sweeteners, stress, and medications. Medications that can cause diarrhea, many medications actually. Medications that work by osmotic mechanism like magnesium-containing antacids or laxatives like mannitol or sorbitol. Secretory diarrhea like in antiarrhythmics like quinine, amoxicillin, clavulanic or augmentin, digitalis, colchicine, biguanides. Non-steroidal anti-inflammatory drugs can cause microscopic colitis. Prostaglandins like misoprostol or cytotec. Motility drugs like macrolides, erythromycin, and metoclopramide or Primbran. Stimulant laxatives like bisacodyl or Sina. Malabsorption drugs causing malabsorption like acarbose, aminoglycoside, or orlistat, which is used for diet. Pseudomembranous colitis can be caused by clindamycin, fluoroquinolones, and penicillin, or even cephalosporins. Antineoplastics or immunosuppressant drug can cause also pseudomembranous colitis. As a differential diagnosis for different causes of gastroenteritis, as a beginning, E. coli will cause fever, abdominal pain, and bloody diarrhea. Salmonella, Shigella, and Yersinia, bloody diarrhea or blood stools. Giardia, history of camping or consumption of untreated water. Rotavirus or Cryptosporidium, exposure to daycare centers. Clostridium difficile, history of recent use of antibiotics. Vibrio cholera, patient will complain of rice water stools. History of receptive anal intercourse will be common with herpes simplex, chlamydia, or gonorrhea. To start the station of history taking for a diarrhea, as we know and as we agreed before, station will be set, dialogue, and closure. For the set or the introduction, as usual, greeting and introduce yourself. Hi, I am Dr. Hadidi, SHO of Internal Medicine. Then confirm patient details. So you are Mr. Muhammad and you are 43 years old. Then build good rapport. Please have a seat. May I sit beside you? Then explain note taking. If you don't mind, I would like to take some notes for the purpose of interview, which will be strictly confidential. Is it okay with you? Agree the agenda. I have received a letter from your GP stating that you have loose motion or diarrhea. Is it right? Then go to dialogue with the presenting complaint, or start with the present history. Can you tell me more about your diarrhea or loose motions? What exactly do you mean by diarrhea? Is it increase the frequency of back passage, or decrease the consistency of the stool, or increase the volume of the stool? Have you had more bowel movements than usual? How many bowel movements per day? What is the usual normal pattern for you? What is the consistency of the stool? Is it liquid? Is it semi-solid? Is it mushy stool? What is the volume of stool, and what is the volume of stool you pass? Then also we'll continue present a complaint about the stool. Is the stool greasy or oily and difficult to flush, like steatorrhea? Is there blood? Is there blood or pus contained within the stool? Is it extremely foul smelling or can contain oil droplets like malabsorption? Do you have sense of incomplete emptying of your rectum, or the need to move your bowels but only mucus passes? This is tenesmus, like an ulcerative colitis or infectious dysentery. Is the pain relieved after a bowel movement, like in inflammatory bowel syndrome? Do you wake up from sleep to empty your bowel? Do your symptoms persist if you stop eating, like in secretory diarrhea? Then as a numeric odbara for presenting complaint, O for onset, did it begin abruptly or suddenly, like in infection gastroenteritis? When did this loose motion start? This is the D duration. Progression, is it becoming worse or improving, or is it the same? Then A, aggravating factors. Do certain foods trigger this diarrhea? Do milk or dairy products worsen your symptoms, like lactose intolerance? Have you noticed symptoms after eating rye, wheat, or barley, like celiac disease? Then regressive factors. Anything makes it better. What makes it better? A at the end is associated symptoms. Many symptoms might be associated with diarrhea. So, is it accompanied by any other problem? Do you have fever? Have you noticed weight loss, like in hyperthyroidism, diabetes, malabsorption, and inflammatory bowel disease? Do you have nausea or vomiting, like in gastroenteritis or bowel obstruction? Do you have abdominal bloating, like inflammatory bowel disease and celiac disease? Have you noticed increased amount of flatus, like inflammatory bowel disease and carbohydrate malabsorption? Do you have abdominal pain? And if there is abdominal pain, don't forget to analyze the pain. Where is the pain? Can you point to one spot that is bothering you? And if it's periumbilical, it's suggested this is a small bowel. Lower abdomen, mostly this is a large bowel, or generalized abdominal pain in inflammatory bowels, irritable bowel syndrome, or ischemic colitis. Other associated symptoms, like do you have feeling of straining, urgency, or incomplete evacuation, like ulcerative colitis or irritable bowel syndrome or proctitis? Do you have joint pain, mouth sores, like in inflammatory bowel disease? Do you have any skin rash like inflammatory bowel disease also? Have you had associated body flushing in carcinoid syndrome? How is your desire to eat? It's very important to ask about desire or appetite. Has your appetite increased like in hyperthyroidism? Have you lost your desire to eat? Do you feel heart racing, intolerance to heat, intolerance to hot weather, or irritability like in hyperthyroidism? Specific questions for diarrhea, you have to ask about signs of dehydration. If there is associated signs of dehydration from frequent diarrhea for many days. So do you feel weak or fatigues? Do you feel dry mouth? Did you notice decrease in your urine amount? Did you suffer any muscle cramps? And when you stand up, do you feel lightheadedness or dizzy? After present history, we'll go for past history. Have you had similar attacks before? Did you see a doctor for colon problem before? What did he tell you? Did you do any intervention like colonoscopy or endoscopy? Did you know what were the results? Have you ever been diagnosed with any medical condition like high blood glucose, gland disease, colon disease, or cancer? Have you ever had surgery for weight loss or hyperacidity, vacuotomy? Or have you ever did intestinal resection or resection of your gallbladder or even gynecological surgery? Have you ever received radiation therapy? As medications and allergy, we'll ask, have you recently began taking any new medications? What medications have you taken? Any over-the-counter, any herbal remedies? Are you currently taking medications for lipid control like statins, proton pump inhibitors, selective serotonin reuptake inhibitors for mood stabilization or something like this, antibiotics? Do you use laxative for any reasons? And also, don't forget to ask about allergies. Do you have any sort of allergies and are you allergic to anything? Then go to family history. Any similar conditions in your family? Does anyone in your family have gland problem, colon problem, or cancer? Like colon cancers, inflammatory bowel disease, multiple endocrine neoplasm, and celiac disease. As a social history, ask about any family member or someone you shared a meal has developed these symptoms, contacts. Have you recently traveled abroad? Did you drink any stream water or bottled water? Do you eat in street restaurants or good ones? What did you eat? So if anything containing mayonnaise, custard, or poultry, might be Staph aureus, fried rice, maybe bacillus, poorly reheated meat or poultry, maybe Clostridium, seafood is common with Vibrio perfringens. When did you eat it? Less than 6 hours, Staph aureus, and 8 to 14 hours, it's Clostridium. 8 to 72 hours, it's Vibrio, and more than 14 hours, it's viral infection. Also in social history, ask about alcohol intake. Do you drink alcohol? What do you drink? What type of alcohol do you drink? How much do you drink per day? Ask about habits of diet itself. Do you use artificial sweeteners? Do you eat spicy food? And ask about work. Where do you work? Like daycare centers, it's common with rotavirus or giardia. Do you have any pets? Turtles and iguanas are common with salmonella. Have you ever had unprotected casual sex? And have you ever been engaged in anal intercourse for herpes simplex and gonorrhea and chlamydia? At the end of the dialogue, don't forget to ask about ideas, concern, and expectations. What do you think might be causing this problem? Are you worried about this being anything in particular? What do you think might be the best plan of action? Then for the closure, may I take a moment to summarize what you have told me so I can check that I have understood everything that's important to you? Is there anything else we haven't discussed that you feel is important? So I think your symptoms might be caused by one of a group of diseases called malabsorption syndromes, and we need to do more tests to know what specifically causing it. I will examine you first, and we will need to do some tests in the form of blood test and may do some images. And then this can be done as an outpatient basis. Then we will decide to admit you or not according to initial results. And as an advice, there are some advice I need to tell you about. Smoking is not good for your health, and I'm going to arrange another meeting to help you quit if you wish. Is there anything unclear you need me to clarify? Thank you, Mr. Muhammad. At the end. Thank you. And these are some presentations in our free medical courses. Thank you and see you soon.